All right, so we're going to go on to our second session of the day, the grievance process, how it works. Next slide. I will introduce our speaker, Erica Anderson. She is a licensed clinical social worker with 20 years of professional experience across a variety of settings. She is currently the manager of patient services for QSource ESRD networks 10 and 12. Erica has 8 years of combined experience working with ESRD patients, caregivers, and families. She has collaborated with dialysis facilities and the ESRD community organizations working to educate and improve the quality of care for dialysis patients. Erica, turn it over to you.
Hello, can you hear me okay?
I can, Erica. Thank you.
All right, thank you for the introduction. Today I'll be going over the grievance process and how it works. Next slide, please. Today's presentation objectives will review the network role as it relates to the Patient Services Department. We will review why grievances are part of quality improvement. I'll provide a grievance overview, patient and facility point of view. I will give CMS's definition of what a grievance is, and then we will discuss the grievance process, the facility requirements, and grievance categories. Next slide, please. Okay. The network role as it relates to the Patient Services Department. As CMS contractors, the networks are to carry out CMS goals through several functions, including identify and facilitate quality improvement activities to improve patient quality of care, respond to grievances and address issues related to appropriate access to outpatient dialysis care, monitor trends in patient grievances, provide technical assistance to facilities, notify state survey agencies when a concern regarding conditions for coverage is identified. Next slide, please. Why are grievances part of quality improvement? Addressing grievances as opportunities for improvement supports a culture of safety. It ensures compliance with the ESRD conditions for coverage. It supports patients' rights, quality assessment, performance improvement, team review of grievance trends, demonstrates cooperation with the ESRD networks. It improves patient satisfaction and can positively impact QIP measures, prevent escalation to disruptive behavior. Next slide. How do you define a grievance? What is your definition of a grievance? Is it a complaint? Is it trouble? Is it inconvenience, or none of the above? Next slide. The grievance point of view. From a patient's point of view, the grievance can be a complaint, a mistake, concern, dispute. From a staff point of view, it can be a disagreement, question, or an opportunity, whether that is an opportunity to learn, an opportunity to educate as a teachable moment. Next slide, please. How does CMS define a grievance? A written oral communication from an ESRD patient or patient representative, alleging that an ESRD service received from a Medicare certified provider did not meet the grievance expectations with respect to safety, civility, patients' rights, and/or clinical standards of care. Next slide, please. The network grievance process, the grievant, which may be the patient, a caregiver, or a family member. And when a family member wants to file a grievance on behalf of a dialysis patient, we do ask that there is a healthcare representative or a form that is completed by the grievant giving permission, or if the family caregiver is the POA, we do request the paperwork as proof because of HIPAA regulations, just to ensure that we are protecting the grievance safety, privacy information. A grievance may be anonymous, unknown to the network, or confidential, anonymous to the provider. If the grievant is not the patient, the network will ascertain the grievant's willingness to have their name revealed to the patient, as well as their willingness to have the patient's name revealed to the provider/practitioners. Only an individual with legal authority to act on behalf of the patient can give permission for the patient's identity to be released to another party. Next slide, please. Types of grievances. We have what's called clinical quality of care grievances. The clinical quality of care grievances alleges services did not meet professionally recognized standards of clinical care, patient-specific in nature, which the care impacted a specific patient, or a general clinical quality of care case in which 2 or more patients at a facility were impacted. Clinical quality of care cases do require RN review, medical records, and PMPs. General grievance, which is a non-quality of care related. Professional conduct is included. An immediate advocacy grievance is simple, non-quality of care related cases. Referral. A referral to the state agency if there is a concern related to the patient's safety or an involuntary discharge. Patient concerns. A patient may contact the network looking for service resources or outreach, or whether if they just have questions. They may not want to file a grievance, but they're just interested in other resources or information that may be assistance to them. Next slide, please. The network grievance process. This is an example of a quality of care concern. The grievant contacts the network. The network obtains permission to contact the facility to address the grievance. The network contacts the facility and sends the grievant a letter, which would be an acknowledgement letter. Findings and improvement for opportunities are shared during this process. Also during this process, the network investigation, including the RN review, which is where we request the records. They have, the facility has 5 days to respond to get the records to us. In the event, normally if we're processing a clinical quality of care case and it may take longer than the allotted time to review and investigate the grievance, we can contact our contract operating officer, which is we refer to as a core, to get an extension for more time allowed to review the case and make sure that we are doing or providing every effort possible to provide quality improvement efforts for the patient and the facility. Next slide, please. Process requirements. Facility policy and procedures must describe all available grievance procedures to the patient, internal process, network, and state survey agency. The procedure is clear that the patient has a right to directly file a grievance with the network or state survey agency without using the facility's process, the facility's grievance process. During this time, most facilities should have posters hanging up in their lobbies where patients are able to easily access the network's information and the state survey information on if they just wanted to contact the network or the state directly without getting any information from anybody in the facility. All information should be listed or shown, hung up somewhere in the facility, very visible to all patients, caregivers, and family members in the lobby. Next slide, please. Conditions of coverage requirements for patients' rights. Patients have the right to be informed of the facility's internal grievance process, of an external grievance mechanism and processes, include how to contact the ESRD network and the state survey agency, of right to file internal grievances or external grievances or both without reprisal or denial of services, and may file internal or external grievances personally, anonymously, or through a representative of the patient's choosing. So each year, even if you are a new patient, you should be informed of your patient's rights and your responsibilities on how to file a grievance with the network. You should be educated annually on your rights and responsibilities and how to file a grievance with the network. If you don't feel comfortable talking to someone at your facility, you can contact the network directly, or you can contact your state survey agency directly, or there should be a process where you can write suggestions down anonymously in your facility. Next slide, please. Process. The internal process requirements include a clearly explained procedure for the submission of a grievance. Allow the patient to file an oral or written grievance with the facility. Provide specific timeframes for a grievance to be acknowledged, investigated, and addressed by the staff. Provides a description of how the patient or the patient's designated representative will be informed of the steps taken to resolve the grievance. Includes a statement that informs the patients that they can file a grievance without fear or reprisal or denial of services. So within each facility, a patient should know the procedures on how to file a grievance. Whether it's written or oral, you should be able to speak to your social worker, the facility manager, a nurse, or you can speak to a patient care tech to get the information to the correct person in order to start the grievance process within your facility. If you are not familiar with how to file a grievance in your facility, get with your facility manager or your social worker and ask them what is your facility's policy and procedures on how to file a grievance. Next slide, please. Culture of safety. Core survey. Evidence of efforts to establish and maintain a facility-wide culture of safety. In the chronic dialysis setting, where patients are encouraged to speak freely without fear of reprisal, patient voice concerns, suggestions and complaints/grievances are expected and indicate the presence of a culture of safety. If the facility responsible person states that there are no patient suggestions, verbalized or written concerns or complaints or grievances, this may be a cause for concern, an indication of an absence of an open communication and a culture of safety. So that's what they're saying is that if a survey agency comes in and they say, oh, we haven't had any complaints or grievances for the year, and this is a 24-chair facility, 3 shifts, which means that's a pretty big facility. That's a red flag for anybody, because whether it's considered to be big or small, an issue or a complaint or a grievance, some patient has stated something, and all facilities should have a process in order for a patient to address their concerns and address the concerns without fear of retaliation or fear of something just, bad happening to them, or the thought that they will lose their chair time or get, booted out of the facility, kicked out of the facility. That is very frowned upon. That is not anything no one in any of the networks condone or support. Next slide, please. What does retaliation look like? Retaliation is subtle changes in staff interactions with a grievant, whether it's negative body language, avoiding eye contact, inappropriate or unkind comments or gestures, delayed response to care needs or requests, neglecting certain routine and duties. Many times, patients do experience form of retaliation in the facilities, whether a person is thinking that they're not doing it intentionally or they're doing it intentionally. Example, the negative body language. When you're normally used to speak to someone and then all of a sudden you have an issue and you want to address it with the social worker or your facility manager, and now the tech is no longer speaking to you who used to speak to you every morning. That is a form of retaliation. Or when they see you coming, they hurry up and turn and go the other way to avoid you. Another form of retaliation. And so professional staff members should be just conscious of those things and how they make patients feel when they do that, whether it's intentional or not intentional. Next slide, please. Definitions of retaliation. The United States EEOC alleged basis that less favorable treatment of anyone after filing a complaint or participating in a grievance process. Legal definition, dictionary, the act of seeking revenge upon another. The patient's perception of care coupled with their belief about respect and professionalism from the staff. Next slide, please. What does an effective process look like? You have clearly defined processes that both patients and staff members are aware of. All patient concerns are addressed, nothing is too small, and all team members are responsible. Uses active listening, acknowledges the patient's feelings, reflects back patient concern to verify. Here is just an example of a chart of how and what an effective process can look like. Patient shares a concern with the staff member. The staff member acknowledges the patient's grievance notifies the manager. The manager addresses and acknowledges the grievance to the patient, meaning letting them know we received your grievance and letting them know the process. We will investigate your grievance. It will take, you can't guarantee the number of days, but you can keep a patient updated on what the process is. You review the findings, you check in with the patient, and then you provide education about whatever the grievance is, whether it's education to a staff member for professionalism, it could be boundaries, it could be a number of things. So once that process is done, then you would ideally have a care conference with the grievant to address what the grievance was and how you were able to resolve it. And if it was not resolved at that time, you reevaluate and reassess so that you can come to an understanding or come to a resolution with the grievance. Next slide, please. Anonymous grievance. Process in which the grievance can be submitted to maintain anonymity. Suggestion box, corporate hotline numbers, documentation of the date of the incident, description of the incident, staff involved, witness accounts, method to share results of the grievance investigation and resolution. A binder could be in a lobby near a suggestion box with results. Next slide, please. Trust building tips. Earn the patient's trust, explain things, be considerate, make patients feel a part of the team, offer inclusion and privacy, listen actively and compassionately, allow patients to express their emotions, affirm no tolerance for retaliation, offer different options for reporting concerns or issues. Next slide, please. So what happens is unresolved grievances can lead to access to care issues. Unresolved grievances where the patient is still frustrated, they feel like they might not be heard, and so they may respond in a different manner out of sheer frustration. So then, which in turn can lead to a call to the network for facility concern that may be related to a behavior, a perceived behavior issue, but it could just be based upon an unresolved issue with the patient and their frustration and the process within the facility. Next slide, please. Network access care to concerns. So we've seen a number of trends in involuntary discharges. The number of physician discharges based on personality conflicts. Discharges due to non-adherence based on which is an invalid condition for coverage. Increasing numbers of immediate severe threat discharges. High number of patients with mental health issues, which leads to lack of education about mental health, limited availability and affordability of mental health services. These are some of the issues that can that lead to access to care issues, and a lot of times it comes from an unresolved issue within the clinic. Not all the time, but majority of the time, once we've investigated it and spoke with a patient, the social worker, or a facility concern in addressing some of the issues, it just leads to misunderstanding, frustrations, and then how people express themselves. One of the biggest things that we get a lot of calls at the network is patients with verbally yelling out in the facilities or different things like that. And sometimes, once again, I'll say it again, that it just comes from a frustration of someone trying to express themselves and they feel like they're not being heard at that time. And then it just boils over to the point where the patient does not know what to do. And that's why we encourage all facilities to make sure that they're educating their patients on the grievance process, because at the network level, we can come in, we can advocate on the patient's behalf, we can do the investigations to help resolve grievances and reach resolutions that is satisfactory for the patients and the staff sometimes. Next slide, please. Some of the resources that we have created on the network level, and these resources are available on our websites, is My Network, What to Do If I Have a Grievance. This is a resource that explains what a grievance is to the patient, how they can deal with their concerns, how they can contact the network. It gives examples of how to stay calm, how to talk it out, to be able to work through your grievance. It also has information where you can write down who to contact and the names of the person at your facility if you have an issue or concern. It has both of our networks for QSource ESRD networks 10 and 12. And it also addresses what to do if you have a safety concern and who to contact. We've also given examples of my questions to ask your care team. Next slide, please. Also, we've included that we share with patients and facilities as well, that we send out with our resources, is the grievance toolkit. We ask that facilities pass it out to patients. We include it in our mailings to patients with the forum and their grievance toolkit. It comes in English and Spanish, and it talks about the grievance process and what to do and what a grievance is. And we provide this to the patients as well. Next slide, please. We also provide information from the ESRD NCC, their brochure on the grievances, the grievance process, why it is very important to let professionals know when you have a grievance or a concern, different things like that, and knowing who to contact. And once again, educating you on how to address the grievances and work with the network or professionals at your facility to help resolve your issues or concerns. I always say no question is never a dumb question. So even if you don't feel, always ask a question. It's better, it's better to know than to walk around and wonder what, leaving your question unanswered. Next slide, please. Okay, and here I just included our patient services department, myself, Erica Anderson, and Keisha Wilson, who works with me, Network 10 and 12. I've also included our website, esrd.qsource.org. We have a wealth of resources on our website for patients and facilities. Next slide.
Great.
Alrighty, if you have any questions, I'm ready.
Thank you, Erica, so much for reviewing the grievance procedure. If there's any questions, we do have some, but just as a reminder to everybody, if you have just questions or comments, just please submit them in the chat. And then there is just one comment from Tony. It says, sometimes it's the patient's personal attitudes, their negative behavior must be considered also. So definitely.
Yeah, it can be. And, sometimes, with everything that's going on in the world today, we're all going through something. And one of the biggest things that I always push when I'm talking to facilities and patients too is empathy. I love sharing the Brene Brown empathy video. It's like a 1-minute video on empathy. And, whether it's a patient or staff, we all need to have empathy for one another. No one ever knows what another person is going through. Patients go through a lot at home that they don't like to share, and staff members as well. But sometimes when I worked in a facility for a very, very long time, and I've seen both sides. Seen sides where, patients don't feel comfortable talking to certain individuals for fear that they may get this or that. And one of the things I always encourage people is the empathy. You got to put yourself in the other person's shoes. Sitting in a dialysis chair for 3 and 4 hours, being stuck with 16 and 14 gauge needles, I can only imagine. And I always try to put myself in that person and how that place and how I would feel in that moment.
Yeah. Good point, Erica. Thank you. Couple questions coming in, so let's kind of hop into them. My clinic has a suggestion box and a patient advocate box. Is the clinic allowed to view these messages and decide which to forward to the advocates?
I'm sure each facility has their own process and how they do it, but I would hope that they would forward all messages put in the box to their patient advocate. That's what it's there for. Looking at your suggestions, taking ideas, and maybe reevaluating and implementing new ideas in the facility. What better person from it to come from than the patients who are the ones receiving the care in the facility. So I can't say because I don't know which facility or place this is, but I'm going to assume if any suggestions are put in the box, they're read and evaluated and determine whether or not they could be of any use.
That's great. Okay, thank you. Another one here from Carmen. Do you automatically give patients information on grievances upon admission?
When I worked in the facility, I did. As a part of my assessment, I had like what I used to call like a little sales saying where I spoke about the grievance process, but I would always ask as a social worker that if you have a grievance, give us the opportunity to resolve it at the facility level. If we are not able to resolve it at the facility level, here's the contact, here is the information for the network, the state, which you're able to call them at any time. But a lot of times when patients call the network, they haven't even discussed the issues with the facility, staff, for whatever their own reasons are. Maybe they've done it in the past and just didn't trust the process. But to answer your question, when I did all my assessments, everyone was educated about the grievance process. Even new patients coming in, when they're signing the patient rights and responsibilities, but you go over it again because for a new patient, that's a lot of information and it can be very overwhelming at one time, especially when you're still adjusting to the fact that you are an ESRD patient.
Yeah, exactly. And actually you lead right into a question that came in, Erica. Before going to the network to file a grievance, who at the facility should a patient talk to if they have a problem?
I would always say your social worker, or if not your social worker, the manager or the charge nurse, or a person that you just trust, a person that you have just built some type of professional relationship with. We know the techs are the ones that the patients see every day. So techs, all staff members should be educated on the grievance process and what to do.
Okay. Yeah, definitely. Just a comment that came in from Donald: understaffing does not help in clinics. So we know what the last 2 years have been like. So
right. Yeah, I think everyone's patience is kind of being tested a little bit with the understaffing issues. And even during those times with understaffing, when we do get the grievances in, one of the things that I like to tell the facilities is we like to reiterate professionalism at that time, because say somebody didn't call in, which throws the whole, you're dependent on a teammate, they don't show up, so the teammates have to rearrange their whole schedule for the day to adjust. But if you're running late and you're putting patients on late, that could resolve a lot of issues if you could just utilize your AA or somebody that has already gotten everything done, just to go out to the lobby and explain to patients, hey, we understand, you want to get on, but we're running a little late at this time. Please bear with us. Just a little bit of courtesy goes a long way, and that helps with a lot of frustration, hostility, anger, outbursts when, because patients want to get on and do their dialysis, and once they're done, they're ready to go home.
Yeah. Another comment, really, Erica, but you might want to speak to it. I think a lot of patients are afraid to voice their grievances for retaliation. They worry that they will jeopardize their care or ability to be referred to get transplanted.
I know. I get those when I call, especially with patients that want to file anonymous grievances. And I always let them know that they have the right to do that, and we will still address their grievance accordingly and appropriately. But we talk about retaliation all the time, and I let them know retaliation is frowned upon at the network level and at CMS level. And if it happens to them while I'm working on a case, please let me know, because I will jump through hoops to get it addressed and get it to who it needs to be.
Great. Got another question for you. What should a patient do if he feels like he's exhausted all avenues for help? Move to another facility?
I wouldn't. Well, it just depends on what we're talking about when you've exhausted all avenues of help. No, you shouldn't have to move to another facility. I believe that that's where, when I spoke about earlier in the presentation, that's where quality improvement comes in. That's where the network needs to know what's going on in your facility, because if it's happening, we actually kind of have a facility like that. A manager just took over, and she is having to almost start over from scratch with her staff, because it's just the professionalism, the professionalism with the staff. People have been allowed to act a certain way for a very long time, and it's hard to break those bad habits, but it has to be done. So if you are feeling like you are at the end, please reach out to your network and allow them to advocate for you on your behalf. There are other avenues to assist, and many people really don't know about the network. So when a patient calls me, the first thing I ask them is, one, how did they get our contact information? And there's a poster hanging in the lobby, and they'll tell, oh, I don't know. And I say, well, next time you go in, hey, just look and let me know. Because if it's not, I'm going to make sure the information gets posted up for the patients to see.
That's right. Okay. A comment here from Julia. She says, social worker provides grievance process information at initial visit to the dialysis clinic, review it at a 90-day and annual assessment, and the clinic has suggestion box and lobby. So exactly correct. Great. What can be done to help a patient who lives out in the rural area and they're feeling like they're being retaliated against, and the next dialysis facility is really far away?
Work with your network and your social worker. I'm not sure what the extent of what the retaliation is, or what the patient is going through at that time. But I just don't like retaliation. I think we're all adults, and I think a person should be able to address their concerns without feeling like someone's not going to like them or someone is going to treat them indifferently. And if it does happen, I'm going to continue to say, reach out to your network patient services staff and let them advocate for you on your behalf.
Okay, great. Just for everybody, if you haven't noticed in the chat, Jerome dropped the link that you can find your ESRD network contact information there. So if you are interested and you're not sure which network you are with, please, there's a link there that's in there now, and you can click on that and find your contact information. So just again, another comment in the chat, Erica, patients do fear retaliation even after they are educated about the grievance process. They fear that the staff will treat them differently. They are afraid. So we know, just again, it's a process.
It's a reality.
Yeah, sure.
It's a reality, and I'm not going to say that it isn't. It's a reality. Even when I was a social worker and I worked in the in-center, I've witnessed it, but I was different. I corrected it. I brought it to the person's attention, not in front of the patient to humiliate anyone. I just pulled them to the side and, just like, you're the professional. You're providing a customer service at the end of the day. If there are no ESRD patients in the in-center, then you have no position in the in-center. So we're here to provide a service. And that's I would tell people, hey, if you got to go in the bathroom, scream, do your dance and get it out, shake it off. But when you come back out on the floor, put a smile on your face and know that this could be you, your relative, your mother, sister, anybody in the chair that you are providing care to, and give them the same respect. Treat others how you want to be treated.
Right. I think we have time for one more. And I know this might be hard to qualify, but how long does it usually take for a grievance procedure for a grievance to be resolved?
Normally, just by the guidelines for an immediate advocacy, we have 7 days or 7 business days. And an immediate, just to give you an example, an immediate advocacy grievance, we get grievances where patients talk about noise complaint. Other patients are on the phone, especially on that first morning early shift, when some patients just want to come in and get their dialysis treatment started and go to sleep. And some people are morning people and they like to talk on the phone, or they don't like putting headphones in. So we would encourage, patients to please be mindful of your other fellow dialysis patients. So, and then a general grievance, which is not a clinical related grievance, but it may have to do with professionalism, staff-patient conflict. Those take 60 days, but sometimes if it takes longer, it could get extended. But we like to resolve the grievance to the point where it's satisfactory for the grievance. We don't want you to contact the network and then feel like that was just pointless.
Well, great. I think there's gone through all the questions and comments in there. And Ken just popped in there. Are there any follow-up during those reviews?
Oh, yes, most definitely. Once we complete the grievance process, we contact the patient back to let them know what we were doing and ask them. I always like asking patients, especially as it relates to professionalism on the floor. Have you seen an improvement? Have you noticed any changes? You know, we know, and then I always let them know change is not going to happen right then and there. It may take some time, but hopefully you start to see some changes. And if you don't, call us back. So we do follow up with the grievance.
Okay. Any other questions or comments for Erica? Should the clinic follow up?
Oh, most definitely. Yeah, if a patient has filed a grievance and the patient has given us permission to contact the facility and want their information to be known that they're filing the grievance, yes, the facility should be following up with the patient. And that just goes again back to customer service, because we're providing a service and the goal is to, resolve the grievance and try to make it where it's satisfactory for the patient, but that is comparable for the facility as well.
Right. Any other questions or comments for Erica? And should clinic follow up with the network intervention?
We do. We follow up with the network. That's where our quality improvement comes in, whether we're working with the facility on quality improvement activities and addressing staff. Now, one of the things I do let patients know when they contact the network that we don't have the authority to hire or fire, because some people call and they want some people fired, but we can't do that, but we most definitely can work on the grievance and advocate still on your behalf.
Okay. And Erica, actually, the question was, should the clinic follow without network? Should the clinic follow up without network intervention?
I would, because it's in my facility. If I was a clinic manager and a patient filed a grievance with the network, I would be following up with the patient, noticing if you notice any changes in the clinic, trying to seek resolve and trying to see if the patient is satisfied. Are they seeing any changes? Do they feel like the grievance is resolved? Yes, they should.
Okay, great. Anybody else have anything to add or ask about the grievance process here? Great. Okay, well, Erica, thank you very much, and a lot of good.
Thank you for having me.
And dialogue. You're welcome. Thank you for being here. We appreciate that.